Hello. So I'm going to talk about schizophrenia, a serious mental disorder in which people start to interpret reality abnormally. It affects how a person thinks, feels, and even behaves. So schizophrenia may result in a combination of hallucinations, delusions, and extremely disordered thinking and behavior that impairs daily functioning and can be very disabling. So people with schizophrenia may seem like that they have lost their touch with reality, which causes them and their family members and friends significant distress. So unfortunately, there is no cure for this disorder yet. So people with schizophrenia need lifelong treatment. Early treatment may help them get symptoms under control before serious complications can develop, and also help the affected individuals to engage in school, work, achieve independence, and even enjoy personal relationships sometimes. So, schizophrenia is typically diagnosed in the late teen years to the early 30s, and it tends to emerge earlier in males than females. In males, it's around late adolescence, early 20s, to the females, which is early 20s and early 30s. So, a diagnosis of schizophrenia often comes after the first episode of psychosis, when the individual first displays symptoms of schizophrenia. But gradual and slow changes in thinking, mood, and social function often start before the first episode of psychosis, usually starting in mid-adolescence. So schizophrenia can occur in younger children, but it's very rare. The symptoms in teenagers are similar to those in adults, but the conditions may be more difficult to recognize. So this is partly because some of the early symptoms of schizophrenia in teenagers are common for typical growth issues during teen years, such as withdrawal from friends and family, a drop in performance at school, like drop in grades and stuff, trouble going to sleep, depressed mood, and lack of motivation. So it's hard to know if these are just normal symptoms of developing schizophrenia or just teenage growing up issues. Also, recreational substance use such as marijuana, methamphetamines, and LSD can sometimes cause similar signs and symptoms. So compared with schizophrenia symptoms in adults, teens can be less likely to have delusions, but more likely to have visual hallucinations. So what causes this? So it's not known for certain what causes schizophrenia, but the researchers believe that a combination of genetics, brain chemistry, and environment contribute to the development of the disorder. Problems with certain naturally occurring brain chemicals, including neurotransmitters like dopamine, which we talked about in class, may contribute to schizophrenia. Several factors contribute to the risk of developing schizophrenia too. So genetics. Schizophrenia sometimes runs in families, but it's important to know that just because someone in the family has schizophrenia, it does not mean other members of the family will have it as well. So genetic studies strongly suggest that many different genes increase the risk of developing schizophrenia, but no single gene causes the disorder by itself. So because of this, it is not yet possible to use genetic information to predict who will develop schizophrenia. And environment. So scientists tend to think that the interactions between generic risk and aspects of a patient's environment may play a role in the development of schizophrenia. So when we say environmental factors, meaning that if the person is living in poverty, he or she is living in stressful surroundings, and maybe even problems relating to his mother, exposure to viruses, and nutritional problems before birth. And what do we mean by brain chemistry? So scientists think that differences in brain structure and function and interactions among chemical messengers, the neurotransmitters, may contribute to the development of this illness. Not disease, sorry. For example, differences in the volumes of specific components of the brain, in the way regions of the brain are connected and work together, and in neurotransmitters are found in people with schizophrenia. So differences in brain connections and brain circuits seen in people with schizophrenia may begin developing before birth. So changes to the brain that occur during puberty may trigger psychotic episodes in people who are vulnerable due to genetics and environmental exposures or the types of brain differences that I mentioned earlier. So what are some of the symptoms of having schizophrenia? There are the delusions, hallucinations, disorganized thinking or speech, extremely disorganized or abnormal motor behavior, and negative symptoms. So what are delusions? These are like some false beliefs that are not based on reality at all. For example, you think that you're being harmed or harassed or being followed, or you think that certain gestures or comments are directed at you while they're not. You think you have an exceptional ability, or that you're famous, or you think that another person is in love with you, or a major catastrophe is about to happen. And delusions happen in most people with schizophrenia, so they are a very common symptom. Hallucinations. So these usually involve seeing or hearing things that don't exist at all. Yet for the person with schizophrenia, they have the full force and impact of a normal experience. So they can be traumatized by these hallucinations. So hallucinations can be in any of the senses, but hearing voices is the most common one. And disorganized thinking or speech is inferred from disorganized speech. Effective communication can be impaired, and answers to questions may be partially or completely unrelated. Rarely, speech may include putting together meaningless words that cannot be understood at all. Sometimes this is known as a word salad. So, extremely disorganized or abnormal motor behavior. So, this one can come out in a number of ways. One is having childlike silliness or unpredictable agitation, like having a state of anxiety and nervous excitement. And your behavior isn't focused on a goal, so it's hard to do daily tasks. Also, behavior can include disorganized speech, resistance to getting instructions, inappropriate or bizarre postures, a complete lack of response, or useless or excessive movements. And negative symptoms. So these refer to reduced or lack of ability to function normally. For example, the person with schizophrenia may neglect personal hygiene or appear to lack emotion. They don't make eye contact at all. Their facial expressions doesn't change, or they speak only in a monotone. It can be also loss of motivation, disinterest, or lack of enjoyment in daily activities. And also it can be social withdrawal and difficulty showing emotions to anything. So in order to be diagnosed with schizophrenia, according to the DSM-4, you have to have 2 or more of the symptoms that I just mentioned. And these have to be present for a significant portion of time during a 1-month period. Also, continuous signs of the disturbance should persist for at least 6 months. And in this 6-month period, there must be at least a month of symptoms, or less if the illness is being successfully treated. The delusions should be bizarre, and hallucinations should consist of a voice, and the 2 or more voices should converse with each other. And there should be a running commentary on the person's behavior or thoughts. And also the disturbance should not be due to the direct psychological effects of substance. So, for example, abuse of drugs or medication or a general medical condition doesn't count. So if you're doing drugs or you're taking some medication that make you have symptoms, you cannot be diagnosed. Also, for a significant amount of time, since the onset of the disturbance, one or more major areas of functioning, such as going to work, personal relationships, and self-care, should mark below the level of achieved prior to the onset. So before the levels should drop. So therapy and also how many people in the world have this illness. So worldwide, about 1% of the population is diagnosed with schizophrenia, and approximately 1.2 of Americans, which is 3.3 million people, have this disorder. And men and women show different patterns of developing schizophrenic symptoms. So males tend to reach a single peak of vulnerability for developing this illness between the ages of 18 to 25, while females' vulnerability peaks twice in their life. So first it's between 25 to 30, but then again around 40 they're vulnerable again. So left untreated, this illness can result in severe problems that affect every aspect of your life. Complications can be like suicide attempts and thoughts of suicide, anxiety disorders, obsessive compulsive disorder, depression, abuse of alcohol or any other types of drugs, including nicotine even, not being able to work or attend school, financial problems and being homeless, sometimes even social isolation, health and medical problems like personal hygiene, and aggressive behavior, although it's not very common. So what can you do to treat schizophrenia? As I said, there is no cure, but also the causes of this illness are complex and are not fully understood yet. So current treatments only focus on managing symptoms and solving problems related to day-to-day functioning. And there are 5 types of therapy used, as you can see here. So antipsychotic medications. They can help reduce the intensity and frequency of the psychotic symptoms. So they're usually taken daily in pill or liquid forms. Some of them are given as injections once or twice a month, which some people find it to be more convenient. And patients whose symptoms who do not improve with standard antipsychotic medication typically receive clozapine. But there is a potentially dangerous side effect that occurs in 1 to 2% of patients. So people treated with clozapine must undergo a routine blood testing to detect side effects. Many people taking antipsychotic medication have side effects such as weight gain, a dry mouth, being restless and drowsy, and some of these side effects may or may not go over time. So psychosocial treatments already. So there are cognitive behavior therapy, behavior skills training and supported employment, and interventions may help address the negative and cognitive symptoms of schizophrenia. A combination of these therapies and antipsychotic medication is usually common. Psychosocial treatments can be helpful for teaching and improving coping skills to address the everyday challenges of having this illness. So they can help people pursue their life goals, like attending school, working, and forming relationships. Individuals who are participating in regular psychosocial treatments are less likely to relapse or be hospitalized again. Family education and support. So educational programs for family members, significant others, or friends offer instructions about schizophrenia symptoms and treatments, and strategies for trying to help the person with the illness. So increasing key supporters' understanding